Health experts are warning of a potential holiday surge in respiratory illnesses as Americans gather for Thanksgiving tomorrow. COVID, flu, and RSV emergency room visits are rising across the country. The CDC says several states across the South are reporting high flu activity. So is California, and health officials in Puerto Rico declared an epidemic earlier this month. So for more on this, I want to bring in Dr. Celine Gounder. She's the editor-at-large for public health at Kaiser Health News and, of course, a CBS News medical contributor. Good to see you, Doctor. So, since early September, RSV visits for children under the age of 1 have increased by 900%. That seems like a huge number, but I don't know if there are concerns or if this is kind of what's expected at this time of year.
This isn't as big as the surge that we had last year in terms of RSV, but the issue is that we have such little bandwidth in terms of pediatric emergency departments and hospital beds that even a small increase in RSV ER visits and hospitalizations can create a huge bottleneck in our health facilities. And so the more that can be done to prevent these little kids, these infants from getting RSV to begin with, the better this holiday season will be for parents and families.
And so, you may pick up RSV, but it doesn't have to be particularly serious. So when should parents be concerned about the symptoms they're seeing?
Well, RSV, and for that matter, COVID and flu, can start off like the common cold. So the sniffles, maybe a cough. But when the virus goes down into the lungs, that's where you get more severe symptoms. And this is unique to these particular viruses, RSV as well as COVID and flu. And that's why people can get so much sicker. So an infant in this situation might have difficulty breathing. You might see their nostrils flaring. They might even have slightly blue fingernails or lips, and they may not be drinking enough in the way of fluids. So these would all be signs that an infant should be brought into the emergency room and evaluated.
And it's not just infants that are particularly vulnerable to RSV, right?
So there are two other groups that we really are concerned about, in particular in terms of vaccination. So we do have 2 vaccines for RSV now. The elderly, so people 60 and over, especially if they have chronic medical conditions, if they live in a nursing home, they are very much at risk for RSV. The other group would be pregnant women. So pregnant women at 32 to 30 weeks of pregnancy should be vaccinated for RSV, and that's not just for their protection, it's also for the protection of their infant. Mothers produce their own antibodies and pass those on through the placenta, through the breast milk, and that's how they protect their babies.
And then just for the rest of us, right? We're all going to be gathering. Right now, I'm thinking about the train ride home because I call it, because I'm on the train all the time. So I call like this weekend like amateur hour because everyone who never takes the train is going to be on. Everyone's sitting on top of each other. And I literally feel like I'm getting every bug possible on the train ride home. What do we do to protect ourselves just from even the general sniffles? No one wants to be under the weather over a holiday weekend.
Well, wear a mask when you're on public transportation. I still wear a mask on the subway here in New York. When you're in the airport, when you're on the plane, I would use those KN95 or even an N95 mask if that's not too uncomfortable. Those give you significantly better protection than either a cloth mask or a surgical mask. And look, no one wants to be sick, as you said, over the holidays. They won't just protect against flu, COVID, and RSV, but against the common cold as well.
All right, Dr. Celine Gounder, thank you so much.